A 28-year-old primary grader at 34 weeks is found to have platelet count of 105 into 10 to the power 9 on routine testing. She is asymptomatic with no past history of thrombocytopenia. Blood pressure and LFT are normal. So this is gestational thrombocytopenia.
Why gestational?
Late 34 weeks and platelet count is
Yeah,
mild reduction and
correct,
around 1 lakh, so it is gestational.
correct. So the answer here is a gestational thrombocytopenia. It is a mild thrombocytopenia, late pregnancy, no symptoms prior to the prior history. Classic is a gestational thrombocytopenia. Okay, ITP
70%.
usually has got a lower counts less than 70 or pre-existing history. Next question, doctor.
A 32-year-old woman with immune thrombocytopenia is planned for induction of labor. Her platelet count is 78, 10 to the power 9, and she requires epidural analgesia. Epidural analgesia is contraindicated, sir, because the platelet count is 78 and the cutoff is 80.
Yes. So epidural is contraindicated. Safe platelet count for epidural should be 80,000 or more. Her count is 78, so borderline, but generally not acceptable. So 80 is the cutoff.
Yes, sir.
Next.
A pregnant woman at 30 weeks
Yes.
A pregnant woman at 30 weeks has platelet count of 60 in 10 to the power 9. She has a past history of low platelets prior to pregnancy, no hypertension or liver dysfunction. So this is ITP because counts
Yes.
are below 60 and she has a past history also of low platelets.
Yes. So answer is ITP. Platelets are less than 70. Unusual for gestational thrombocytopenia. History outside the pregnancy is also present. So that will give clue to the ITP. Gestational thrombocytopenia will not have such history. Okay, and it will be mild. Next, doctor.
Yes. Hmm. A woman with ITP at term has platelet count of 55 into 10 to the power 9. Fetal monitoring is reassuring. What is the most appropriate mode of delivery? Mm, we should a vaginal delivery.
Yes, because her platelet is 55,000. Vaginal
Yes,
delivery is safe more than 40. Okay.
yes,
Instrumental more than 50. Okay.
yes.
80,000 for the
Epidural,
this epidural spinal.
epidural.
Okay.
Hmm. तो 55 में vaginal delivery is answer.
Yeah. Okay. Vaginal delivery. So delivery
Hmm.
mode, obstetric indication, go by the obstetric indication only. So no evidence of that cesarean section reduces the fetal bleeding risk. Avoid fetal scarlet or traumatic instrumental delivery. Okay.
Yes.
Next question.
29-year-old woman at 32 weeks presents with thrombocytopenia, confusion, fever, and mild renal impairment. LFT is normal. Sir, this is HUS because
Yes.
there is thrombocytopenia and the systemic symptoms and kidney involvement.
Do you feel it is HUS or TTP? I
So
think it should
renal
be TTP.
so TTP में how will
See,
you
there is a
differentiate between
confusion also. Mild renal involvement is there, no? If there is a mild renal involvement, there will be overlapping features in both TTP and HUS. So I think here the answer should be TTP because there is a confusion. Okay, and involvement of the renal is mild. Okay, in
it means
HUS you
there are
let us see.
CNS symptom
See,
also and
yeah,
renal also. So
yeah.
that is why it is TTP.
That is why it is TTP. Okay, so
Okay.
classic, there
Yes.
is a classic TTP pentad. There is a thrombocytopenia. Neurological signs are there: fever, renal involvement, and microangiopathic hemolysis. So these are the 5 features, if they are there, then you have the TTP: thrombocytopenia, neurological signs, fever, renal involvement, and microangiopathic hemolysis. So health will have deranged LFTs and no prominent neurological features. Okay. So this we have discussed already. So that finishes the questions of thrombocytopenia.